তো এটা একটা ইজি রিমেম্বারিং। যাকে বলছি এটা কি, পাটা দেখেই মনে হচ্ছে যে কেউ লাথি মারবে, পাটা তুলতে যেমন কিরকম একটা অনীহা, আর হাতটা যেই বলছে হাতটা তোল, এটা কি, তখনও একটা কিরকম, ওটা না দিলেই পারেন একটা ভালো ব্যাপার। কিন্তু আমি তোকে বলি, অ্যাটলিস্ট ইউ হ্যাভ টু আইডেন্টিফাই দি বোনস অ্যান্ড অলসো, বিরাট কিছু প্রশ্ন করার আমাদের সময় নেই, তো সেটা তোমাদের যেন নম্বরটা দেওয়ার জায়গা থাকে। আমি যাদেরকে নিয়েছিলাম, পারফরমেন্স ইজ নট গুড, আমার এটা 50-60 মানে মেমোরি লস হয়ে যাচ্ছে মনে হচ্ছে। তো দেখো, যেটা পারফরমেন্সটা, আমি যে একদিন পরীক্ষা নিয়েছি, সেখানে কিন্তু খুব একটা যে দারুণ কিছু প্র্যাকটিক্যালতে তোমরা আইডেন্টিফাই করো, বলো, স্মার্টলি তোলো। আর এখন ওই যে 5 জন করে দিচ্ছি পরীক্ষাটা, নাহলে পরীক্ষা শেষ হবে না। কিন্তু মোটামুটি এটা যদি ভেবে নাও যে ও ঠিকঠাক হয়ে যাবে, তো 2.5 মাস আছে, 2.5 মাস নয়, মেটা ধরেই নিলাম 8 দিন 9 দিনের ব্যাপার, মে, জুন, জুলাই, অগাস্টে পরীক্ষা, তো 3 মাস। 3 মাস তোমরা অ্যানাটমির সময় একদম সেটে থাকো একদম। ধরো ক্রেনিয়াল বোনস, ক্রেনিয়াল অস্ট্রোলজি এবং ইয়োর সফট পার্ট, সফট টিস্যুস, এগুলোর মধ্যে তুমি ভাগ করে নাও। 3 ঘন্টার মধ্যে তুমি 1-1.5 ঘন্টা ম্যাডাম যখন পড়ালো বা ম্যাডারা পড়ালো, হ্যাঁ, তো সেই সময়টা তুমি সেইটাতে ফোকাস করলে, কিন্তু বাই দ্যাট টাইম হোয়াট ইউ মিসড, ইউ ওয়ান্ট টু রিভাইজ, ইউ রিভাইজ। কারণ এই আধ ঘন্টা চলে যায়, 1 ঘন্টা চলে যায়, কিন্তু এটা বললাম আমার মনে হয়েছে। আর এটা একটা ইজি দিস থিং, দ্য টার্সাল বোনস, হ্যাঁ, এটা তোমার 3 cuneiforms, talus, T for talus, calcaneum and cuboid। এটা মনে রাখলেই তোমার ফুট বোনস হয়ে গেল। ওদিকে মেটাটার্সাল, টার্সাল, তারপর ওদিকে phalanges। এটা একটা ব্যাপার। Now today's lecture will be focused on, if you want to copy the diagram, you just can copy. Now, thyroid gland, it's a very important endocrine gland, and situation in front of the and side of the trachea, opposite 5th, 6th, 7th cervical vertebra. Special features unique among endocrine gland that it manufactures, stores, and then release the hormones. Only endocrine gland that depends on external environment for manufacturing its hormones. Richest blood supply, normally not palpable. This is important, normally not palpable. একজন পেশেন্ট তোমার ঢুকলো চেম্বারে, একটা রুটিন সার্ভে করে নিতে হবে। You just, if she complains এখানেটা কি ফুলে গেছে, something is swollen here, then you look into it, that's the thing matter. But routinely একটু দেখে নেবে এটা যে থাইরয়েডটা সোয়েলিং আছে কিনা, একটা ঢোক গিলতে বলবে। জাস্ট ইউ আস্ক দি পেশেন্ট টু ডিক্লুড, এমনি করবে, তখন ওঠানামা করছে, তাহলে ইউ ড্র, হ্যাঁ। Now, coverings of the thyroid, true capsule formed by thickening of the fibrous stroma of the gland. False capsule derived from splitting of pretracheal layer of deep cervical fascia. Now, when you will be dissecting the neck, deep cervical fascia comes as a question, and it goes and covers the thyroid gland, and that attachment will be taught in a different lecture and class. Now, tracing of the capsule of the above to the hyoid bone in thyroid bone in the midline and to the oblique line of thyroid cartilage on each side. Below its pretracheal fascia enters the thorax and blends with the fibrous pericardium. Pulse capsule is thin along the posterior border of the lobes due to the thyroid tumor grows posteriorly without visible swelling in the front. Now you have to be why that the posterior lobes they swell, but you cannot visualize that. So you order for an USG and also MRI CT, because if you take the component now, everyone is even the village folks. Every lady comes with the thyroid report, but she is having anemia. She doesn't have the hemoglobin report. মানে এটা এমনই বলবো ভাইরাল হয়ে গেছে যে ladies they are coming with self. Actually, that is being done by the assistant to the physician, I would say. I won't call them the quack doctors or something like that. But they are making the test and giving you. So if anyone is having a problem with thyrotoxicosis or any pain in the neck, don't take it lightly. Capsule thickened to form the ligament of Berry, which connects the medial surface of the thyroid lobes of the gland with cricoid cartilage. Thyroid gland is identified during inspection by asking the patient to deglutate and then by a finger placed on the structure which moves on deglutation. Next. Weight is 25 grams. Size, female is more than the male. The thyroid gland of the female is a bit larger than the male. Increase during pregnancy and menstruation. Consists of two lateral lobes and one isthmus, which connects the two lobes. Pyramidal lobe presents in 40 to 50% of the cases. Next. Now, lateral lobes, each lobe is pyramidal in shape. And see the pyramidal lobe, right lobe, left lobe, the thyroid gland. And you can see the thyroid cartilage, cricoid cartilage. The measurement length is 5 centimeters, breadth is 3 centimeters, and thickness is 2 centimeters. 5, 3, 2. The measurement of the thyroid gland presents an apex, base, and 3 surfaces. Anterolateral, posterolateral, and medial. 2 borders, anterior border, posterior border. Next. Now, the apex direct upwards was the oblique line of thyroid cartilage, sandwiched between the inferior constrictor and medially and sternal thyroid laterally. Due to this, the thyroid enlargement cannot extend above. Now, next. It is important to ligate the superior thyroid artery close to the gland to avoid injury to the nerve during thyroidectomy. This is important because near the apex, the superior thyroid artery and the external laryngeal nerve diverge from each other, and away from the apex, they come close to each other. So during surgery, it is needed to ligate the artery close to the apex to avoid injury to the nerve. Like a question came in your uterus, the relation of the ureter and the uterine artery. Next, similarly, this is important. Now the lateral lobe's base directed downwards and extends up to the fifth or sixth tracheal rings. At the base, it is related with the inferior thyroid artery and recurrent laryngeal nerve. This is very important. At the base, it is related with the inferior thyroid artery and recurrent laryngeal nerve. Near the gland, these two structures come close to each other, but away from the base, they diverge. So during surgery, the inferior thyroid artery is ligated away from the gland to avoid injury to the recurrent laryngeal nerve. It is highlighted actually. So that can be a small question, and also the recurrent laryngeal. Next. Now lateral lobe surface, anterolateral surfaces is overlapped by the muscles of the neck, sternothyroid, sternohyoid, superior belly of omohyoid, and part of the sternocleidomastoid. All these muscles, they are related. So the sternothyroid, the sternohyoid, superior belly of the omohyoid, and part of the sternomastoid. And medial surface is related with the rule of two tubes, larynx and pharynx, two muscles, the inferior constrictor and cricothyroid, two nerves, external laryngeal and recurrent laryngeal nerve. Now, a short note, the rule of two, right? You get 2 marks or 3 marks. So, in thyroid, actually, it can come as a full question, and also it can be split into at least 6 components. The arterial supply, or the true capsule and the false capsule defined, and the relation of the recurrent laryngeal nerve and the nerves. And next, now lateral lobes, posterolateral surface is related to the carotid sheath. Borders, anterior borders separate the superficial surface from the medial surface, passes downwards and accompanied by the anterior descending branch of the superior thyroid artery. Posterior border separates the medial surface from posterolateral surface and associates between superior and inferior thyroid arteries. Parathyroid glands, thoracic duct on the left side. Next. Isthmus connects both lobes across midline. Vertical and transverse diameter are same. This is the isthmus. Connecting these two. Now, the pyramidal lobe occasionally extends upward from the isthmus close to the midline. Sometimes the fibromuscular band, the levator glandulae thyroidae, extends from the thyroid bone to the isthmus or pyramidal lobe. It is striated muscle. Lower border inferior thyroid vein is related to this border. Next. Now, arterial supply, superior thyroid artery, branch of the external carotid, inferior thyroid artery, branch of the thyrocervical trunk. Arteria thyroidea, occasionally present, branch of the brachiocephalic trunk or arch of the aorta. It supplies the isthmus. So, the when you dissect the triangles of the neck and the neck, you will be seeing these are all visible. All are visible. You can just accessory thyroid arteries derived from esophageal and tracheal arteries. Next. Now, venous drainage arises from the venous plexus, deep to the true capsule, and drained by superior thyroid vein, drained into the internal jugular vein. The middle thyroid vein drains into the internal jugular vein, and inferior thyroid vein drains into the brachiocephalic vein. Sometimes a fourth thyroid coccus vein arises from the lower pole and drains into the internal jugular vein. It may bleed profusely during surgery, so should be searched and ligated before surgery. So it might, short note means your Cocker's vein. Cocker's vein. This is just a short note. Okay. Now, next. Now, lymphatic drainage. Lymphatic from the plexus around the thyroid follicle and the vessels are arranged in two groups, upper and lower. Upper group drains into the pre-laryngeal and jugulo-digastric lymph nodes, and lower group drains into the pretracheal and group of lymph nodes along with the recurrent laryngeal nerve. Next. Histology of thyroid gland. Round to oval follicles, single layer of cuboidal to low columnar epithelium called follicular cells secrete T3, T4. Lumen of the follicle contains colloid, which is pale inactive follicle, and deep in inactive follicle stored thyroglobulin. Parafollicular cells, also called C cells, they are scattered in between the follicular cells and in between the follicles. C cells contain clear cytoplasm with oval nuclei, difficult to identify on H and E stain. So, the sections we show in the histology is the H and E stain. You need a special stain for this. So, leave it, at least you can mention that. Derived from neural crest cells and secrete calcitonin. Now, next. Now, the epithelium of the follicle, parafollicular cells, C cells, follicular cells, blood supply, you can see the thyroglobulin and lymphatic vessels. See the beautiful picture and the basement membrane diagram of the simple thyroid follicle. Next. Now, histology of the thyroid gland, you can see the parafollicular cells, follicle with colloid, three follicular cells are there. Connective tissue stroma, arterioles, similar. Next. Now, development of the thyroid, endodermal diverticulum thyroglossal duct. Now, stroma, thyroid follicle, double cellular plates, which is formed after repeated division of lower end of the thyroglossal duct within the thyroid mass. Synthesis of hormone starts between 18 to 22 weeks of intrauterine life. Fetal pituitary thyroid axis works independently of the mother as TSH does not pass through the placental media. Now you can see the foramen cecum of the tongue, thyroid development of the thyroglossal duct and retrosternal thyroid if developing process goes too far. But retrosternal thyroid, if it develops more, it is an anomaly actually. But now the site of origin of thyroglossal duct between floor of the branchial arches 1 and 2 and thyroglossal duct, endodermal downgrowth of thyroid epithelium from it. Developing tissue invade hypobranchial mesenchyme which gives capsule and septa. Sites of thyroglossal cysts move up with the protrusion of the tongue, remnant thyroid tissue, lingual thyroid, and fistula, sinuses, and pyramidal lobe. This is a very common presentation. একবারে যে দেখতে পাবে না তা নয়, মানে you have to identify and also the জিভ টাংটা protrude করতে বলবে, এমনি করতে হবে তখন এটা টান পড়ে যাবে. Because it is connected, thyroglossal duct is connected with the foramen cecum. Next. Now this is development of the thyroid when you got the branchial arches. Next. Applied anatomy of the thyroid. Next. Next. Now thyroglossal cyst, 7% of the population has remnant of the thyroglossal duct. Cyst anywhere along the length of the duct, 60% infrahyoid. You can see the hyoid bone, infrahyoid. 24% are suprahyoid in between the, and 1% intralingual. Now 1 to 2 centimeters of cystic mark that is mobile on swelling and protruding of the tongue. Next. এই এটা কি হচ্ছে? ফোন ফোন কিসের জন্য? এটা ডিউটি করতে এসছো, এটা দেখো, সাইলেন্ট থাকবে। 60% content thyroid tissue. Malignancy is rare. Acute infection contains mucus-like clear fluid. It is become symptomatic. It must be removed. Cyst trunk operation. This is the thyroglossal cyst. Next. Lingual thyroid, failure of thyroglossal duct to descend. A mass at the foramen cecum, asymptomatic or present with airway obstruction, may be the only thyroid tissue. Now you can see the lingual thyroid. If a baby or a child comes with dyspnea or some breathing problem, you think of any upper respiratory tract infection, then tonsils you can think of, that is obstructing the airway passages. Now, but keep in mind the lingual thyroid, and it might be the only thyroid tissue in that child. So don't be in a hurry to operate or something. You have to investigate, and if it is posing some very much problem, then you can think of that's a matter to discuss. And you see, at least I have not come across in this my 18 from since 81, 82, or hospital from 81. So it is we have not come across at least. At least I have not come across. Personally, I have not come across. So it's a rare condition. Next. Ectopic thyroid tissue anywhere along the migratory route of the thyroid, mediastinum, larynx, trachea, pericardium, or esophagus. Next. Congenital intrathyroid cyst present in children, persistent ultimobranchial bodies, or an intrathyroidal thyroglossal duct cyst. So it's a very rare condition. Next. This is a large multinodular goiter. It can be such big. But as এটা 40 বছর 30 বছর আগে এগুলো দেখা যেত, এখনো দেখা যায়, but so it's becoming rare because of more facilities, but absolutely it remains an issue, health issue. এই যতগুলো দল আছে ভারতবর্ষে, they are not putting health first. जो भी है वो चलता है, बात करते हैं उसमें, but they have, any party in India has not put health issues as the prime backup. That's why in a country like us, still you have to have quacks. I mean, have to have quacks something. But they must be literate. They must given a training. That's also a course. It's a global problem. That's why assistant to the physician in America, they handle major centers, যেগুলো remote. ওদেরও তো সেই গ্রাম জঙ্গল আছে, তো এটা একটা ইস্যু, কিন্তু বড় ইস্যু। তো নেক্সট, নাও colloid goiter. Next, these two pictures, and there is a third picture, is taken from recent edition of Bailey and Love surgery. It will be in your text, I don't know, but Indian authors, I don't know the recent books, whatever it is, but we read Bailey and Love, and I tell you, একটা বই করো, গীতা গীতায়, কোরআন কোরআনি, গ্রন্থ সাহেব for Sikhs, গ্রন্থ সাহেব। তো তো ডোন্ট এইটা এটা নিয়ে জাগল করবে না, একটা টেক্সট বুক ফলো করো, এবং এর সঙ্গে নিশ্চয়ই যারা নোটস দিচ্ছে বা অনলাইনে পড়াচ্ছে সেগুলো যা করবে করবে, ইট ইজ ইয়োর পার্সোনাল ইস্যু, বাট ভালো বই এটা সারা পৃথিবী জুড়ে চলে। আর একটা বই ফারকুয়েশনস অপারেটিভ সার্জারি, ফারকুয়েশনস অপারেটিভ সার্জারি, বেলিয়ার লাভস সার্জারি, লেটেস্ট এডিশন, মানে একটা ট্রান্সফরমেশন ফ্রম আ স্মল বুক লাইক দিস, ঠিক এরকম, বাট size is 10 inches, something like that. Thick is this. But that book has come into 2 volumes of this size. A4 এর থেকে একটু বড় paper, beautifully illustrated. You want to have a surgical foundation, you must read. দেখো এগুলো কেন বলছি, বিকজ একটা আমার শহরে যদি একটা বড় কাট থাকে ইনজুরি এই হাতে বা ইয়েতে, ওখানে হসপিটাল সুপার স্পেশালিটি বোর্ড টানিয়ে দিয়েছে, ডাক্তাররা আছে, দে আর ওয়ার্কিং, তারা চাপে থাকে, আর বাদ বাকি 2-3টে নার্সিংহোম আছে, কিন্তু এগুলো ম্যানেজ হচ্ছে না। একদমই ম্যানেজ হচ্ছে না এগুলো। কিন্তু এইসব বই পড়ে যদি তুমি দেখো, এই একটা হ্যান্ড কেটে এসছে, ডাক্তারবাবু ডিউটিতে আছে, সে আর উঠলোই না, এই দেখে নে রে, দেখে নে, যে ওয়ার্ড বয় আছে সে, তারা কিন্তু ভালো সেলাই করে। তো এগুলো ওখানে তুমি প্রত্যেকটা কম্পোনেন্ট পাবে। আর এখন যেভাবে ওরা সাজিয়েছে, the way biliary love is being presented, it's a কি বলে চুম্মা বলতে না, ইউনিক। ফারকুয়েশনস অপারেটিভ সার্জারি, এইসব বইগুলো আমাদের ফাউন্ডেশন দিয়েছে। আর ফারকুয়েশন অপারেটিভ সার্জারি দেখে আমি গ্যাস্ট্রোইন্টেস্টাইনাল সার্জারি করেছি, শিখেছি। একটা পিরিয়ড ছিল 81 to 85, 84, এই পিরিয়ডে আমি যা পেয়েছি তাই করেছি। তখন ইউএসজি ছিল না, তখন একটা কোলেসিস্টিক তোমার ডায়াগনোসিসের প্রচুর সমস্যা ছিল, ক্লিনিক্যাল বেস করে সেটার উপরে কাজ করা, আমাদের মাস্টাররাও করতেন। এমনি দেখবে তুমি যতই যাই রিপোর্ট করাও, কিন্তু ডাক্তারবাবু রেডিও ডায়াগনোসিসের এমডি, ডিএনবি, এফএস, আমেরিকা, এইসব লন্ডন, মানে প্রেসক্রিপশন প্যাডের হাফ A4 সাইজের পেজ হচ্ছে ওইসব পিজিডিএম, অমুক, ডায়াবেটোলজিস্ট, ডায়াবেটোলজিস্ট কথাই বলে না। অর্থোপেডিক্সের ডাক্তার পেন নিয়ে এসছে, তারপর পেন ম্যানেজমেন্ট ফ্রম পেন ইনস্টিটিউট, এই হনলুলু। হ্যাঁ, তো এই যে একটা ক্রেজ, না দিস ইজ ক্রেজ। এমআরসিপি পার্ট 1, এফআরসিএস পার্ট 1, ঠিক আছে, পার্ট 1 দাও। তো তোমরা লাস্ট ফেজে একদম 3 মাস কোনো কথা নেই, মাদুর পাতো আর আদা নাও, একটু চা করো আর খাও, আর রাত্রি 1-3টে অবধি পড়ো না, রাত্রি 12টা ম্যাক্সিমাম শুয়ে পড়ো, 5:30 থেকে 6টার মধ্যে উঠে যাও। ওই মর্নিংয়ে ইয়োর ব্রেন ক্যাপাসিটি, তাই জন্য বলে ব্রহ্ম মুহূর্ত, ওই পিরিয়ডে অ্যাবজর্পশন প্রচুর হয়। আর গ্রুপ সে তোমাদের ভালো লাগার মানুষকেও নিয়ে সঙ্গে নিয়ে পড়ো, তোমার নিজেরা 4জন বন্ধু বান্ধব মিলে পড়ো, হ্যাঁ, কিন্তু পড়ো, দেখবে ইউ উইল ওয়াক থ্রু, বিকজ ইউর অ্যাটেন্ডেন্স, ইয়ে বলছিল, আমি বললাম দেখ অ্যাটেন্ডেন্সটা তো এদের ঠিক আছে, কিন্তু তোমাদের একটু তোমরা যে পড়ছো না তা নয়, তোমরা এই ফরম্যাটে খেলো, তাহলেই খেলা হবে, ঠিক আছে? ওকে, দিস ইজ আ টোটাল থাইরয়েডেক্টমি for this hormonogenetic goiter in a 14-year-old girl. Next. Thank you. I have great expectations from you people. And আগাম আমি ফাইনালের জন্য উইশ করে দিলাম। লেগে থাকার অর্থই বিজয় লাভ। আমি দেখি আমি যখন তোমাদের পরীক্ষায় 3টে ব্যাচ হয়ে যাবে, I'll try to 2 hours I'll take from us, Ayun and Malay Babu, to you become a good MBBS. You will become a good postgraduate.
C7 or C6? It is C6. Okay. Write it down, the vertebral level. What is the vertebral level for larynx? Larynx e koto theke koto bolechilam? C3 to C6. Okay. So about the thyroid gland, tell me how many parts it has got? It has got 3 lobes. 3 lobes actually, right lobe, left lobe, and also it has got 1 isthmus, right? So do you know what is the length, breadth, and the 2.5 into 2.5 into 1. Okay, this is the length of the lobe. Okay, what about the isthmus? Isthmus hole koto hobe? 1.5. Okay, so how many surface it has got? Kotogulo surface ache? How many surfaces? Anterior surface, posterior surface, and also medial surface and posterolateral surface. Okay, write it down. It has got 4 surfaces. Okay, so thyroid gland is the largest endocrine gland. It is brownish red in color and it is a very highly vascular organ. Okay, so could you tell me what about the blood supply of thyroid gland? একটা তো বলতেই পারবি, টেল মি ফার্স্ট ব্রাঞ্চ অফ এক্সটার্নাল ক্যারোটিড আর্টারি। এক্সটার্নাল ক্যারোটিড আর্টারি ফার্স্ট ব্রাঞ্চ কোনটা? superior thyroid artery, and another artery is coming, that is the inferior thyroid artery. So how the inferior thyroid artery is coming? Thyrocervical trunk. Okay, and another one is thyroidema. Okay, arteria thyroidema. It is coming from where? Arch of aorta. Okay, so occasionally how much percentage it is present? Only 30%. Okay, so this is about blood supply. Why it is important? What are the chief disorder of thyroid gland? দুটো আছে, একটা হচ্ছে তোর goiter, একটা hyperthyroidism, একটা hypothyroidism. So what do you mean by goiter? Swelling of the thyroid gland. It is due to lack of which minerals? Iodine. Due to iodine deficiency, right? So that's why we are having the goiter. So which are the other cases you will see thyroid? There are carcinoma. Okay, papillary carcinoma, follicular carcinoma, numerous carcinomas are there. Okay, so what is the peculiarity? Suppose thyroid, you want to remove the thyroid. So would you remove the whole gland or not? And why? We are not removing the whole gland. We are doing ki kore? Subtotal thyroidectomy. Subtotal thyroidectomy means below the total. Okay, subtotal. Why we are doing? Very good. Parathyroid gland. How many are there? 4. Posterior surface e 4te button er moto. Parathyroid gland. And why this parathyroid gland are concerned? What is the function? So it is decreasing or increasing? So increasing hormone is? Calcitonin is secreted by C cell from the thyroid. So entirely calcium absorption and metabolism is done by thyroid. Okay, indirectly by thyroid, some amount by the parathyroid. Okay, so these are the hormone. So what about the function? There are 2 type of hormone, যেটাকে একটা বলছি triiodothyronine T3, another one is thyroxine T4. So which hormone is regulating these 2? TSH is secreted from anterior pituitary. Okay, so that is also known as adenohypophysis. Okay, so if suppose T4 is increased in the blood, what will happen? Feedback. So there would be negative feedback. Okay, So how the thyroid gland is controlling other function? Number one function is what? Main function. Chief function is the BMR. Second function is it is also regulating what? The gonads. Okay. It is also regulating the menstruation. Okay. So there is in female the thyroid is gradually means it is a common thing to be enlarged. Okay. And which time you will see it is more enlarged? Do you know? Not only pregnancy, also during menstruation. Okay, so these are the two conditions when we will see the thyroid gland is enlarged. Okay, so next one is, so another one is there is calcium metabolism and psychosomatic growth of the body. So just write down the three functions. First one is the maintaining the BMR. First one is to maintain the BMR. Second one to promote the psychosomatic growth. To promote the psychosomatic growth, and the third one is to modulate the calcium metabolism. Okay, these three functions are the main function you have to mention. Okay, to modulate the calcium metabolism. Okay, so what are the peculiarity? So this is a number one is strong hormone. Okay, because T4 and T3. Which one is the maximum quantity found in blood? Maximum quantity কোনটা পাও? T4 না T3? হ্যাঁ? Which one is the active form? T3. And which is found more amount in blood? That is T4. Okay. Now write down about the vascularity. Okay. So it has got the, I already mentioned, it has got the maximum amount of blood supply. Okay. So now tell me the visceral relation. Anterior and posterior side. What about the visceral relation? Anterior triangle. You got the thyroid gland. So anteriorly, which other structure you will get? Superiorly কে কে থাকে বল? Superiorly থাকবে hyoid bone. Okay, then below first structure you will get the two cartilage. Above you will get the thyroid cartilage, then cricoid cartilage. Then in front of cricoid cartilage we are having this thyroid gland. Now if you go to posteriorly, which are the structure you will come across? Trachea, then you will get the esophagus. Okay, now tell me which are the muscle you will get? Anterior to the thyroid, which are the muscle? All strap muscle. Write it down. There are four muscles. There are four muscles which is present anterior to the thyroid gland. Anterior to the thyroid gland. Number one is sternothyroid. Number one is sternothyroid. Then next one is superior belly of omohyoid. Superior belly of omohyoid. Okay. Then the third one is, which would be the third one? Sternohyoid. Sternohyoid. Okay. And most anteriorly sternocleidomastoid. So these four muscles you have to remember while you are studying the thyroid gland. Okay. Now there are two ligaments that are attached with the thyroid with different parts. Which, write it down, ligament which is attached with the thyroid gland with the hyoid bone, that is known as ligamentum thyroidi glanduli. Ligamentum thyroidi glanduli. একটা বড় লিগামেন্ট থাকে, ওকে, হাইরয়েডের সাথে থাইরয়েডের কানেকশন, ওকে। And now another one, thyroid to the trachea posteriorly. So that is known as কে বলবে? Which ligament is present between the trachea and the thyroid? Ligament of Berry. Write it down. Ligament of Berry. So these are the two ligaments you have to remember, okay. So write it down. Which are the presenting parts? Presenting parts are right lobe, left lobe. Then next one is pyramidal lobe. So which one is the pyramidal lobe? Is it always present? No, occasionally. So it is present just superior surface from the isthmus. Okay. And write it down. Thyroid is the one of the organ where the width is more than the length. Isthmus of thyroid is one of the example. Isthmus of thyroid is one of the example where the width is more than the length. Okay. আর কি কি anatomical organ আছে? Where you have got width is more than the length? Liver. Which side you are saying? Liver is extending from the inferior surface ততটা extend করে বুঝতে পারলি? পাঁচটা অর্গান আছে, একটা বললাম, আরেকটা হচ্ছে প্রস্টেট, রাইট ইট ডাউন, আরেকটা হচ্ছে প্রস্টেট। নাম্বার 3 is the pituitary. Number 3 is the pituitary. Okay, and another one is cecum. একবার লেন ব্রেথ গুলো গিয়ে দেখে নিবি বাড়িতে। ওকে, সিকাম। আর একটা হচ্ছে সিলিয়াক ট্রাঙ্ক। ঠিক আছে, তোমরা দুটো পি, দুটো সি, একটা টি। ঠিক আছে, তিনটের উইথটা বেশি হবে লেন্থের থেকে। ঠিক আছে, now about the location. So that is C5 to C7 and sometime T1. It depends. Okay, C5 to C7. Okay, so now coming to the lobes. So if you see the lobes of the thyroid gland, it would be extend up to the 6th tracheal ring, up to the 4th to 6th tracheal ring. So just write it down. Extension is from 4th to 6th tracheal ring, whereas isthmus is from 2nd to 4th. Isthmus is from the 2nd to 4th tracheal ring. So now see how nicely the organ is present. Okay, so anteriorly you could find that is the hyoid bone. Tarpore next তুই কি পাচ্ছিস? That is the cartilage. Which cartilage? The thyroid cartilage and the cricoid cartilage. Just below that you are having the thyroid gland. Okay, so you could see the weight of thyroid gland is very much important. How much? 25 gram. Okay, weight টা কিন্তু দিতে পারে MCQ তে। Okay, weight of thyroid is 25 gram. Okay, so they just said about the thickness. Okay, so see, at first we are having the hyoid bone, then there are one membrane that is known as thyroid membrane, which is extending from the hyoid to the thyroid cartilage. Okay, and so you could say the pyramidal lobe. Okay, pyramidal lobe is connecting where? To the cricoid cartilage. Okay, it is touching over there, that surface. Okay, আর ওখানে লিগামেন্টটা কি বলেছিলাম? লিভেটার গ্র্যান্ডুলি থাইরয়েডি, লিভেটার গ্র্যান্ডুলি থাইরয়েডি। Why it is present, do you know? Occasionally you will get one case where you will say persistent thyroglossal duct. Have you studied that one? Persistent thyroglossal duct. Glossal means what? Tongue. So in some patient, if you ask, just protrude the tongue, what will happen? Thyroid will be moving upwards, downwards. Why? Because they develop from same source. Okay, write it down. Tongue and the thyroid both develop from thyroglossal duct. Okay, thyroglossal duct. Okay, so you could see it is extend up to the 4th tracheal ring. Okay, so now showing the vertebral level. So vertebral level is from C5 to T1. Okay, now already we have mentioned everything, so write it down. The capsule. Capsule of thyroid gland is very much important, and right here one explain why thyroid surgery, why during thyroid surgery we are opting from outside. এটা আমি বলেছিলাম, তাই তো? হোয়াট ইজ দ্য ডিফারেন্স বিটুইন থাইরয়েড এন্ড প্রস্টেট? ভাইবাতেও জিজ্ঞাসা করেছি। will tell. Thyroid has got how many capsule? True capsule, false capsule. True capsule, which one is the true capsule which is adherent to the gland? Okay, inner one. And outside false capsule is coming from where? Write it down. False capsule is coming from pretracheal fossa of the deep cervical fossa. Pretracheal fossa of the deep cervical fossa. Okay, now write it down. Venous plexus. The internal venous plexus is present interior to the true capsule. Interior to the true capsule in case of thyroid. Okay, so যেহেতু interior আছে, you could definitely take out the gland. Okay, but not happening in case of prostate. Why? Because prostate is same gland আছে, there are two capsules. One is true, another one is false. But there is vertebral venous plexus which is present between the two capsules. Okay, so if you go approach from outside, what will happen? There would be bleeding. Okay, so সেই জন্য যদি ধর BPH হয়, benign prostatic hypertrophy, we used to do কি প্রসিডিউরটা বলেছিলাম? TURP. TURP মানে কি? Transurethral resection of prostate. Okay, so we'll opt from the urethra. From the inside, we'll remove the gland from the urethra and we'll remove the gland. Okay, prostate. So এটা কিন্তু ডিফারেন্স আসতে পারে. Okay, surgery of the prostate and the thyroid. Okay, about the capsule. So now coming to the another fact that in case of female it is usually larger. So just write it down. In case of female it is larger when during menstruation and also during pregnancy. Okay, so there are two conditions. Okay, when it is enlarged. Okay, now coming to the special features. So special features are two. Already I have discussed pyramidal lobe, that is also occasional finding, and another one is levator glanduli thyroidi. Okay, so it connects the pyramidal lobe to the hyoid bone. Okay, this thing you have to remember. Okay, now see, this is the capsule. Okay, true capsule and false capsule. So true capsule is inside, false capsule is outside, and you could see the venous network, it is present inside the true capsule. Okay, and false capsule is coming from where? Pretracheal fossa. Okay, so this thing already I told. Suspensory ligament of Berry. So suspensory ligament of Berry connecting, already I told you, from the thyroid to the trachea. Okay, আচ্ছা, তারপরে দেখ, so why we will ask if there is elevated enlarged thyroid gland, we ask the patient please swallow something. Why? Because of this thyroglossal duct. Okay, ওইটার জন্য যখনই টাংটা মুভ করে, then also thyroid gland used to come down or up. Okay, so this is a gradual finding. Okay, now coming to the relation, write it down. How many surfaces and border it has got? It has got one apex. Apex টা কোথায়? Directed কোথায়? Superiorly. Apex is directed superiorly. Base is directed downwards. Okay, and there are three surfaces: lateral surface, medial surface, and posterolateral surface. Lateral surface, medial surface, posterolateral surface. So parathyroid gland is present on which surface? Posterolateral surface. Okay, then there are two border, anterior border and the posterior border. Okay, now write it down. Apex is directed, এটা কিন্তু MCQ আসতে পারে. Apex is directed to which muscle? Apex of the thyroid gland is directed to which muscle? Number one is sternothyroid. Sternothyroid. Second one is inferior constrictor of pharynx. Inferior constrictor of pharynx. Okay, now coming to the base. So base relation e ke asbe? 2. Apex e aro duto jinis related thake, write it down. Apex is also related to one artery, one nerve. Kon artery hobe? Superior thyroid artery, external laryngeal nerve, external laryngeal, SE. Okay, SE ওই দুটো একসাথে থাকবে। এপেক্সে, বেসে কি থাকবে? recurrent laryngeal nerve, and another one is inferior thyroid artery. Okay, these two things you have to remember. Base ke related, apex ke related. Okay, so jeta ami bolchi recurrent laryngeal nerve, another one is giving branch to the whom, to the vocal cord. বুঝতে পারলি? So you will see some patient of the thyroid patient, they used to have hoarseness of voice. Okay, so that is a common relation because supplied by same nerve. বুঝা গেল? এবং থাইরয়েড সার্জারি করে যদি কোনোভাবে this recurrent laryngeal nerve has got any damage, what will happen? The patient could not able to speak. ঠিক আছে, তো সেটা হতে পারে hoarseness of voice ও হতে পারে. Now see, this is the relation. এটা অলরেডি এপিক্সটা লিখেছিস, বেসটা লিখেছিস. ওকে, নাও ল্যাটারাল সারফেস, রাইট ইট ডাউন. ল্যাটারাল সারফেস ইজ কনভেক্স. Lateral surface is convex and it is covered by, see the four muscle, already I told you. তাই তো চারটে মাসেল, sternothyroid, sternohyroid, sternocleidomastoid, another one is superior belly of omohyoid. ওকে, চারটে মাসেল পাবি ল্যাটারালি. মিডিয়ালি কি কি পাবি? সবকটা অর্গান পাবি, রাইট? সো কি কি পাবি? ট্রেকিয়া, ইসোফেগাস, inferior constrictor of thyroid, and also cricoid and thyroid cartilage. Okay, and there are two nerve, external laryngeal, recurrent laryngeal, দুটোই পাবি medial surface এ. ওকে, এগুলো কার ব্রাঞ্চ রে? phrenic nerve এর ব্রাঞ্চ, ভেগাস. ইট ইজ ভেগাস. phrenic nerve কোন সাইডে থাকবে? সাইডে থাকবে. মিডিয়ালি যেটা যাচ্ছে কি সেটা ভেগাস, তাই তো? ভেগাস নার্ভ হবে ওটা. আচ্ছা, posterior lateral is very much important. কোন স্ট্রাকচার পাচ্ছিস? carotid sheath. ওকে, carotid sheath এ কি কি কন্টেন্ট? internal carotid artery, vagus nerve, which vein? Internal jugular vein, and there is sympathetic chain. How could you forget sympathetic chain? Common carotid এর কোন ব্রাঞ্চটা যাবে? ইন্টারনাল ক্যারোটিডটা যাবে ক্যারোটিড শীথ দিয়ে. আর which is carotid body and carotid sinus? Body is concerned with chemoreceptor or baroreceptor? Opposite হবে, chemoreceptor. ওকে, আর carotid sinusটা কি হবে? baroreceptor. Yeah, this thing you have to remember. আচ্ছা, বর্ডার কি আছে? রাইট ইট ডাউন. বর্ডার হচ্ছে anterior branch of superior thyroid artery. Now see one thing, superior thyroid artery has got two branch, anterior branch and posterior branch. এই যে posterior branch, it will communicate with the ascending branch from the inferior thyroid artery. Okay, so just write it down. Superior thyroid artery has got two branch, anterior and posterior. Okay, now the posterior branch of superior thyroid artery will communicate with the ascending branch of the inferior thyroid artery, or anastomosis with the ascending branch of the inferior thyroid artery. So why we are forcing over here? There is one point at this anastomosis, if you trace, you will get the parathyroid gland. Understood? You will get the parathyroid gland exactly at the point of anastomosis. Okay, so which is very much important for surgery. Okay, so this thing you have to know. So this is arterial anastomosis for the parathyroid gland, and also you could get another structure, that is the thoracic duct. Thoracic duct কোন সাইডে থাকে? To the left. Okay, আরেকটা স্ট্রাকচার দেখ পাওয়া যায়, সেটা হচ্ছে thoracic duct, লেফট সাইডে থাকে. লেফটে তার যখন শুরু হচ্ছে সেই পয়েন্টটা পাবে, Okay, now this thing they have told just the relation of the apex and base. Okay, apex you have written, which thing are related? Superior thyroid artery সাথে which nerve? External laryngeal, SE. Okay, আর base কি থাকবে? internal thyroid artery আর তোর recurrent laryngeal nerve. Okay, now coming to the lateral side, medial side, so they have told these all things. Okay, these are the surfaces and borders. So see, this is the relation. তো এখানে কি কি পাচ্ছিস? কোনটা থাইরয়েড রে? এটা থাইরয়েড. ওকে, ব্রাউন কালারটা হচ্ছে থাইরয়েড গ্ল্যান্ড, তাই তো? So anteriorly you are getting all this muscle, right? What about this? This is the carotid sheath. এটা কি? এটা হচ্ছে trachea. Okay, এটা কি? Esophagus. এখানে কি পাবে? Recurrent laryngeal nerve. কারণ ওটা বেসে থাকে। Okay, so this is a cross section. Okay, cross section of the thyroid gland. Now coming to the border, write it down. Border. First one is the anterior border. It is thin. Okay, is used to separate superficial and medial branch. Okay, and posterior border you will have three things. So this, write it down. Posterior surface e ki pabi? Tinte jinis pabi. Number one is anastomosis. Anastomosis between the superior and inferior thyroid artery. Anastomosis between superior and inferior thyroid artery, parathyroid gland, and thoracic duct on the left side. Okay, so these are the relation on the posterior side. So isthmus is somewhat same. So all the muscle you will get. Okay, so just write it down. This last point. Okay, inferior border. Inferior border, inferior thyroid vein used to emerge, and also inferior border দিয়ে কি আসবে বলেছিলাম? The arteria thyroidema. Last IMA আছে, okay? Arteria thyroidema. So it is coming direct branch from the arch of the aorta. Okay, it is direct branch from the arch of the aorta. আর তাহলে ওখানটা লিখে রাখ, inferior thyroid artery is a branch from thyrocervical trunk. Right side আর left side same হবে? Thyrocervical trunk টা left side এ same হবে? Thyrocervical trunk টা কোন দিকে পাবে? Right side এ, left side এ কার থেকে আসবে? Left side এ direct আসবে subclavian artery. So just write it down. Thyrocervical trunk on the right side, whereas directly it is coming from the subclavian artery in case of left side. Okay, so see very nicely they have shown this is the arterial network. So this is highly vascular organ. Okay, highly vascular organ, and see from arch of aorta it is coming, that is arteria thyroidema. Okay, now coming to the venous drainage. So see, rather than arteria thyroidema, there is another artery. So that is known as accessory thyroid artery. So just write it down. 4 arteries: superior thyroid, inferior thyroid, then thyroidema and accessory thyroid. Okay, venous drainage কি কি হবে? superior thyroid, middle thyroid, inferior thyroid. দেখ তিনটে ভেন কিন্তু, ঠিক আছে? লিভারের মতো, লিভারে দুটো আর্টারি, তিনটে ভেন। তো এখানেও তুই তিনটে ভেন পাবি, superior, middle, inferior. Additionally, you are having another vein that is known as Purchase vein. Okay, additionally fourth vein দেখা যায়, তার মানে এখানেও 4, here also 4. Okay, so এই কটা ভেন কোথায় ড্রেন করে প্লিজ সি, একমাত্র একটাকে ছাড়া সবকটা করবে ইন্টারনাল জুগুলার ভেন। So which one is draining to the brachiocephalic vein? Inferior thyroid vein. এটা একটা স্টার্ট দে। Okay, inferior thyroid vein is draining where? To the brachiocephalic vein. Okay, leave this one. Now coming to the venous drainage. Okay, so venous drainage are 4. Number 1 is superior thyroid vein, superior thyroid vein, middle thyroid vein, inferior thyroid vein, and 4th thyroid vein. Just write down the last point. Please write down the last point. It would be always towards the gland. বুঝা গেছে? It would be always towards the gland. কেন? কারণ ওই যে বললাম superior thyroid artery, external laryngeal nerve দুটো একসাথে আসছে। তাহলে দুটো যদি একসাথে আসে, তুই যদি ভুলে নার্ভটাকে টাই করে দিস তাহলে ভোকাল কর্ড গেল। বুঝা গেল? So these thing you have to be very careful. So you have to always tie towards the gland. হ্যাঁ, আরেকটা জিনিস কি, তোমাকে দেখতে হবে কি 30% পপুলেশনে থাইরয়েডিমা থাকে। তো অনেক সময় কি হয়, এই দুটো আর্টারি লাইগেট করে দিলাম, এর কথা বলে গেলাম, গ্ল্যান্ডটাকে রিমুভ করে দিয়েছি। সো দেয়ার উড বি এক্সট্রিম ব্লিডিং, ওকে, অন দ্য ইনফিরিয়ার সারফেস। ওকে, সো এখানে যেটা দেখেছি এটা শুধু রিলেশন আছে। ওকে, রিলেশন অফ দ্য ডিফারেন্ট টাইপ অফ গ্ল্যান্ড। সো হুইচ অর্গান ইজ দিস ওয়ান? এই কি কার্টিলেজ দেখলি এটা? ইট ইজ দ্য থাইরয়েড কার্টিলেজ, যেটাকে বলছে তোর অ্যাডামস অ্যাপেল। ওকে, এই যে সারফেসটা এটা ঠিক এর উপরে থাকে, ঠিক আছে, এরকম ভাবে থাকবে, বুঝতে পারলি? তাহলে এইটা যেটা দেখতে পাচ্ছি এটাকে পিরামিডাল লোব বলতে পারি, এটা ইসমাস, এটা রাইট লোব, এটা লেফট লোব। আর এই পোস্টেরিয়ার সারফেসে আমি কি পাবো, প্যারাথাইরয়েড গ্ল্যান্ড পাবো, এখানে 4টে পাবো, তাই তো। এবং যখন আমি সার্জারি করবো সবসময় সাবটোটাল থাইরয়েডেক্টমি করবো, পুরো গ্ল্যান্ডটাকে রিমুভ করবো না, কেন, প্যারাথাইরয়েডটা রিমুভ হয়ে যাবে, ঠিক আছে। আর হিস্টোলজি তোরা জানিস,